Now, you need to hear this. 80% of those that come to do pregnancy tests with us are either those who have missed your period or those whose own are delayed. If you have ever expected something to come at a particular time, especially something very important, and it did not come, there's this worry that starts building up. So that's how it is for ladies who have missed their period. I remember this lady. She was praying and crying at the same time, as if that alone can bring back her period. Anyway, I don't know how that works, but you needed to see her relief when the PT test came out negative. And then comes the big question. If she wasn't pregnant, why was it not coming? Because at the time of this incident, it was already a week late. So ordinarily, you should have expected that even if there's a delay, a few days after, it should have come. But it did not come. So what actually might be going wrong? You see, just like this lady, many women would actually think it's pregnancy, and that's why a lot of them rush to do pregnancy tests first to confirm, especially those who are sexually active. But then the truth is, there are a whole lot of other things, which pregnancy is one of them. And this can cause mixed feeling, especially among those who have not made enough arrangements for a new baby to come in. And sometimes it can bring similar signs that are seen during pregnancy, and so that can make it more confusing. But the truth is, during whole lot of other things. There are a whole lot of clinical conditions that can make one to miss a period or make the period to be delayed for a while. So if you have tested the right way, using the right method at the right time, and still we are getting a negative result for pregnancy test, then it might actually be a time for you to check for other things. And to make things easier for you, we have packaged this video to walk you through some other conditions that can make you to miss your period. So ensure you watch to the end. And mind you, this channel is specially dedicated for your education on everything about your health. So you wouldn't want to miss any of our videos for anything. And for that not to happen, please hit that subscription button. I'm not just doing that. Ensure you turn on your notification button, so each time we drop a video, it will be easier for you to get it at your end. So now let's get to the real deal of the day on the causes of missed period where you are not pregnant. Number one is stress. Yes, stress is really underestimated in this part of the world. You see, a lot of people are going through a lot. The country is in serious situation, and then a lot of things are stressing many people. People are going through a lot, including me. I'm going through a lot too. But see the real deal. When you're stressed out, your body releases this hormone called cortisol. And cortisol is not really a nice one. It has a way of altering the hormone responsible for your ovulation, which can make you not to ovulate. And then when you don't ovulate, it might be a little bit difficult for your period to come that moment, because there's a whole lot tied to your ovulation in terms of you seeing your period. And so whether you are going through mental stress, emotional or physical, whatever it is, probably your work is stressing you, or you are having some financial issue, or you are not getting enough rest or enough sleep, your body might actually be trying on a survival mode at that particular point in time without paying more attention to the things that make you ovulate. And then again, there are other things, other medical conditions that can put your body at stress. Things like chronic diseases, infectious diseases, or you are taking medications. At that moment, your body might just press a pause to everything about your reproduction just to get things sorted out. If you are stressed out for whatever means, at that moment, your period coming might be under serious probability. Now, the second thing is hormonal imbalance. Yes, for your period to come, there are different hormones that are responsible. Hormones like luteinizing hormone, follicle stimulating hormone, there's estrogen, progesterone, and to some extent prolactin and testosterone. So all these hormones have to be at their balance, at their particular or specific amount. So if anyone should go out of point, maybe go higher than it should or go lower than it should, then there's likely going to be a problem. And this hormonal imbalance thing is usually common among women with ovarian syndrome or those with ovarian insufficiency, especially those ones responsible for your ovulation. Remember, we said no ovulation, there might likely not be menses. For those that have these conditions, you see them with irregular menstruation, missed period, delayed period, heavy bleeding, acne, excessive growth, and many other conditions that will follow up thereafter. If you're having any of these not in the right shape, you might be in for a missed period. And then again, there's this other class of hormone called thyroid hormones. These are responsible for metabolism in most cases, but then their imbalance can also affect affect the functions of these other ones responsible for your monthly menstrual cycle. Number 3, sudden weight changes. So your body works this way. It needs a particular amount of fat to maintain a regular menstrual cycle. And so if there's a sudden loss or sudden gain in the weight, then there's likelihood of you missing your period. In particular, if there's sudden weight loss, you're going to have a decrease in the level of estrogen. There's going to be a low level of follicle stimulating hormone and luteinizing hormone, which are usually needed at the initial stage of your menses to bring out your ovulation. So if these things are not in the right order, you might be in for a missed period. So for those of you who are on strict diet, or who are starved, or who are fasting for a long period, your body might just be telling you, look, hey, you are not ready for reproduction. We understand that this might be voluntary, or this might be something you give your permission, but then with this amount of fat in your body, you might not be able to handle everything about reproduction. Number 4, excessive exercise. Yes, exercise is good. It can help maintain a very healthy body. It can help regulate your mood and also to lessen the pain you feel during your menses. But then when it becomes too much, it can pressure your body. It can put a lot of stress on your body, which can affect estrogen too. The last on the list is birth control pills and contraceptives. Yes, we understand that sometimes you might want to space out your childbearing, or you might not be ready at that particular time for pregnancy. Yes, that's understandable. And for that reason, you might likely try to use one of these control pills. It's like Levofem, Postinol-2, IUD, or whatever. We're not saying it's bad, but this is something you should have at the back of your mind. All of them, whichever one you try to use, whether you are starting it or you're switching from one to the other, or you are stopping, you should know this. All of them work similarly. They try to alter your natural menstrual cycle, thereby stopping ovulation. And so if you're not ovulating, there's almost an impossibility of you getting pregnant. And so when you are now trying to stop, when you are done using them, it takes a while for your body to return to its natural state that it was before you started using all this. So as these things are happening, you might not be able to see your periods. And that's not because you're pregnant, it's because your body is adjusting. Now, this is very important. Some of these cases might not be as serious as the other. For instance, when you miss your period, when you did not see your period on a particular day you're supposed to do it, that might be a delay. In some cases, it can come after a few days. That's just a delay. If you're stressed out or you are taking medications and all that, you might want to try and work with some things that will reduce the stress or settle the situations that are stressing you out, and everything will come to normal. But then, if you have noticed that you did not see it the first month, the second month, the third month, that's serious. That's something you need to see your doctor, especially if you notice other things like lower abdominal pain, discharges, some acne, and things like that. Please rush to the clinic and see a gynecologist. Just look at what this lady did. She noticed the first month it did not come. She went to do all the tests, do a pregnancy test. She wasn't pregnant. Second month did not come, and she was immediately advised to see a doctor. That she did, and it was discovered that she has hyperprolactinemia, which is one of those hormonal imbalance we mentioned earlier. And what did the doctor do? She placed her on some medications, and after a while, she got back to her normal, healthy states. This might not exactly be your case, but meeting a specialist, meeting an expert in that field can go a long way to help you. So we're not trying to scare you. No, we're not trying to do that. When you miss your period or have it delayed, it's just a way of your body telling you that something might be wrong somewhere. And instead of panicking, or instead of trying to jump into some unnecessary conclusions, why not pay closer attention to what your body is telling you? Why not just listen more, observe more, and then seek the right help from the right person? Because that alone can guarantee you getting all the best of results you ever need. If you have ever had this kind of case, if you have ever missed your period or have it delayed for some time, we would like to hear how it happened and how you were able to manage it or bring it back to normal. And if you have any questions concerning all those things we have said, please feel free to ask us so that we'll go through it and learn together. Ensure you share this video to as many as can get it. And thank you so much for watching. Do well to get on this movement by subscribing to our channel. Thank you once again, and see you in the next.